to end this chaos. But look around. Look at what the Republicans have inflicted on the American people. Cuts to Medicare, cuts to Medicaid, cuts to the Affordable Care Act, cuts to children's health insurance, cuts to medical research. All of this to take that money and give it to the very wealthiest in the form of tax cuts. And then what? After they've done this, created this healthcare crisis, how do they respond to their own chaos? They shut down the government. And they're taking it quite literally because they're not even showing up to do their jobs. And they're saying, we can talk about all of this some other time. How about November? Why don't we talk about the end of November? Speaker Johnson had a quote. He said, we have an eternity to deal with healthcare. No, we don't. That's the point. They are making healthcare more expensive for everyone, but we have a particular urgency around the ACA. And let's spell out what they did. They took away the tax credits that help people pay for premiums. They chose to spend that money on permanent tax credits for billionaires. Then, when they took those away, insurance companies responded by raising premiums. And notices of those increased premiums are going out over the next days and weeks. And families are finding out at home in my district that their premiums are about to double. They are having to make impossible financial decisions right now. And let's go to Benton, Louisiana, right in the heart of Mike Johnson's district. A couple making $88,000 a year in Benton, right now they pay just under $7,500 a year for health insurance. That is not cheap. But now, while Mike Johnson has his members on vacation, keeping the government shut down for another week, that couple is finding out that their premiums are about to triple, that their premiums will go to more than $23,000 a year. Nobody can afford that. That is putting insurance out of reach for Americans. And that is what is happening right now in Mike Johnson's district. And it's happening to the people that he is paid to represent. And this is hurting everyone. Cancer survivors, small businesses, moms, kids, and the real kicker, 267,000 veterans will lose their insurance as these ACA premiums skyrocket. But instead of showing up for work, coming to the table, negotiating with us, they are now also spreading that pain to our current service members who are at risk of missing their paychecks and going unpaid for serving our country because the Republican Party cannot even get its act together to come and do what we do in every shutdown and agree that we pay our troops. Mike Johnson said that's a show vote. I can't imagine anything more disrespectful. But that's their response to this is that we're just not even going to show up, that we are done negotiating. We have made our bargain. It is a billionaire's first plan. So here's my plea to Republicans. If you're not going to come to Washington, walk across the street, go next door, talk to your neighbors. Hear about the true anxiety they're feeling. Hear about the betrayal they feel that Donald Trump told them he was going to lower costs on day one and has done nothing but make life harder and more expensive. Then get on the next flight to DC and come and work with us. Stop these premium hikes, get our troops paid, get government up and running. Enough is enough. But I am honored to introduce someone who always shows up and has spent her career fighting for the rights of every person for affordable, accessible, high-quality health care. A proud alum of our Ways and Means staff and former administrator for the Center for Medicare and Medicaid Services, CMS, we are so proud to welcome back to the Hill Chiquita Brooks LaSure. And Chiquita, the floor is yours. Thank you for joining us.
Well, thank you so much for the invitation. It is always a pleasure to be here with you. I have spent my career as a former administrator of CMS and as a health policy expert, really trying to make sure that we have a more accessible and affordable healthcare system. And I am deeply concerned about the impending healthcare crisis facing our nation. Earlier this summer, congressional Republicans passed their budget bill that cuts over $1 trillion from Medicaid and the Affordable Care Act marketplaces, the largest healthcare cut in our nation's history. This, along with other actions and inaction, puts 15 million people at risk of losing their healthcare coverage. The first effect will be sticking over 20 million Americans who receive coverage through healthcare.gov or state-based marketplaces with a bill that doubles their health insurance premiums next year. Marketplace premiums will skyrocket by hundreds to thousands of dollars. People could start to see this sticker shock starting on November 1st, which is in just a couple of days from now, when people go to sign up for their coverage for next year. I really want to take a moment to put this in the context of the average American. About 1 in 2 American workers, about 2 out of 3 American workers are unable to pay a $500 emergency expense. This means that for so many Americans, they are one bill away from being in a very difficult place. The impact of these premium tax credit cuts could mean that if your roof leaks, you can't pay for that and your health insurance. Or if your car gets flat tire, the car that you use to get to and from work, these are the costs that we are talking about for the average American of these premium increases. Someone who makes $35,000 a year, which is about $17 an hour, will see their premiums rise by nearly $1,600 when the tax credit ends. If they try to make up this difference, they would need to work the equivalent of 11.5 hours a day for 18 days straight. This does not account for their childcare, the gas, and the other expenses that would come so that they could increase their working hours if their employer allowed them to do so. Let us not also forget just how important the ACA is for our small businesses. Nearly half of adults who are in the marketplace who are employed by a small business, who are self-employed, or small business owners themselves rely on these tax credits. On average, in a family business run by a 60-year-old couple making $85,000 a year are looking at a premium increase on average of about $22,000 next year. We should be celebrating small businesses rather than placing excessive strain on them to afford health insurance. The enhanced tax credits not only made coverage more affordable for working middle-class Americans, it also in turn made the ACA market more stable and kept costs down for all enrollees. But I would be remiss not to mention the looming crisis facing millions of Americans and healthcare workers who rely on Medicaid. The budget law makes many changes to Medicaid that will have ripple effects that could push Medicaid enrollees, like children with disabilities, adults who are juggling multiple jobs, older Americans who rely on home and community-based services, but not just those people, but our healthcare system and our state budgets may be pushed to their breaking points. Although many of the Medicaid provisions in the bill do not take effect until around 2027, we have already begun to see the effect on our healthcare system, which will harm all of us. Over 300 rural hospitals are at risk of closing due to Medicaid cuts. In Georgia, a large health hospital system announced just a couple of weeks ago that they were closing their labor and delivery unit due to the budget law. Rural clinics in Virginia and Nebraska have already announced their plans to close. We were already in a healthcare crisis in many ways. When I was CMS administrator, I would often hear stories across this country about the impact of rural closures on rural communities, from a widespread job loss due to the rural hospital being the community's larger employer to families having to drive further during an emergency. As a mother myself, I certainly understand the stress that you would think when you hear that your labor and delivery unit is closing. Nobody wants in this country a mother to have to deliver her baby on the side of a highway because she could not make it to the hospital on time. But that's the situation that we are facing in parts of our country. None of these things are inevitable, neither the shutdown nor higher healthcare costs. It is a choice that congressional Republicans and the Trump administration have made. They have created so much uncertainty in the healthcare system, uncertainty that will continue to cause more hospitals to close, insurers to raise premium costs, and people to choose to go without a health insurance. The American people should not have to choose between affording groceries or paying for health insurance. But if we continue this trajectory that congressional Republicans and the Trump administration have sent us down, that may very well be the choice that many individuals and families as early this fall will have to make. Thank you.
Thank you so much, Administrator Brooks LaSure. Thank you for your leadership and for all you have done to expand affordable healthcare access. We know when Democrats are in charge, we deliver on our promises of lowering costs and making healthcare more accessible. This has long been a Democratic priority. It is thanks to Democrats that the Affordable Care Act today provides tens of millions of Americans with coverage. But when Republicans are in charge, they do everything they can to undermine healthcare. We saw this with their signature legislation this year, which kicks more than 15 million Americans off of their health insurance. That was the largest healthcare cut in American history. And now Republicans are doubling down on the healthcare crisis they've created, failing to work with Democrats to prevent the ACA tax credits from expiring. The American people want Congress to work together to ensure health insurance premiums don't go up at the end of the year. The clock is ticking, and open enrollment begins next week. More than 20,000 Californians in my district alone will see their premiums go up from this crisis, and many will see their premiums double. Failure to extend these tax credits is not an option. We'll cue up a video.
While Republicans shut down the government, they're driving up healthcare costs for families. Their big, ugly bill cuts Medicaid, targets Medicare, and takes healthcare away from hardworking people. And now, families are paying the price. In Speaker Mike Johnson's district, a 60-year-old couple's premiums could rise by nearly $20,000 a year. That's not an expense any family can afford. While Republicans reward their donors, Americans pay the bill. That's why Democrats are fighting to protect our health care.
Now, someone who knows this all too well is our next witness. It's my privilege to introduce Mariah Plant. Mariah is a small business owner in Wyoming County, West Virginia, who serves as the main caretaker for her brother, Matt, who is legally blind and nonverbal. Medicaid has been a lifeline for their family. It allows Matt to live at home while covering his doctor's visits and medications. But with Republicans doing everything they can to cut Medicaid, Americans like Matt face serious challenges to getting the care that they need. And caregivers like Mariah worry what will happen to their loved ones if costs go up and healthcare falls out of reach. Mariah, thank you for joining us today and for speaking up in service the tens of millions of Americans who rely on Medicaid like your brother, Matt. You're now recognized. Make sure. There you go.
Warned me to turn that button on, and I just flat out ignored it. Thank you very much, everyone, for having me and for taking the time today to hear from us citizens about how these cuts are going to impact all of us. I want to also apologize in advance for my tone. I recognize that we're all on the same side of this fight, but I got a lot of mad in me, and I want people to hear it because I represent the mad that is inside a lot of people in West Virginia, especially in rural parts of my state where we feel like we've just been hung out to dry by this whole process. I know I personally feel like I'm being attacked from all sides. Like I said, my name is Mariah Plant. I'm 29 years old. I'm a small business owner, and I live in rural Wyoming County, West Virginia. I work full-time from home while also caring for my older brother, Matt, who, again, is legally blind, has nonverbal autism, and needs significant help with nearly every aspect of daily life. Medicaid is our lifeline in West Virginia. It pays for his medical care, his prescriptions, his eyeglasses, which are about an inch thick, and behavioral support, which are services that we could never afford on our own. Most importantly, Medicaid allows him to live at home, surrounded by people who love him, instead of at a facility where staff are often overworked and undertrained to care for people with complex needs. Just last year in Preston County, West Virginia, a man not much older than my brother, who is also nonverbal and has lifelong developmental disabilities, lost his life in a facility like this because it was understaffed and underfunded, and the people in charge of his care left him in a scalding hot bathtub for an hour. When they found him, his skin has melted from his body, and he was deceased. He could not cry out in pain. He could not tell them that the water was too hot. He could not even struggle to get himself out of the tub on his own. And I think of that man every time I give my brother a bath. And we switch the water from hot to cold to hot to cold to hot again to a little bit colder. And we switch out the washcloths just so. And we play the special bath time song. And it requires a lot of love and patience that I don't think somebody making minimum wage is going to be able to offer him. Caring for Matt in our home also saves the government thousands of dollars a year compared to what it would cost to house and care for an individual with similar care needs in a state hospital or assisted living facility. But now, on top of threats to Medicaid, my own health coverage is in jeopardy. I currently receive an enhanced premium tax credit, an EPTC, which reduces my monthly health insurance premium from $829, which is double my car payment, down to $218. Very manageable. That covers 77% of my annual premium cost, making it possible for me to afford coverage while caring for my brother. If these enhanced tax credits expire, my monthly premiums will nearly double, jumping from $218 to $388 before I ever see a doctor or pick up a prescription, which, by the way, the one prescription I do take will cost me another $150 a month. That's a devastating hit for working people like me. And I'm not alone. Americans across the country are opening letters from their insurers right now, learning that their premiums are skyrocketing because Congress has not acted. We are facing an unprecedented healthcare crisis. Families are watching their costs explode in real time, and Democrats have been clear. They're ready to negotiate a bipartisan agreement to reopen the government and extend these tax credits so we can stop these massive premium hikes. But Republican lawmakers have to come up off the golf course and off the beach and sit down and negotiate in good faith on behalf of the hardworking Americans like myself who they were elected to represent. You may think that West Virginians are too poor or too uneducated to know when we are being sold a bill of goods, and maybe that's what they are counting on. But there is not one good thing in this bill for West Virginia. And we are not for sale. Where I come from, the stakes could not be higher. If H.R. 1 takes effect, at least 7 rural hospitals, including Welch Community Hospital, which is the closest medical facility to where I live in Pineville, still 40 minutes away, but a manageable 40 minutes. 7 of those facilities will close within the next 2 years. That means more people driving further for emergencies and regular healthcare visits, more strain on our already fragile healthcare system, and more lives at risk. This ain't about politics. It's about people like my brother, like my neighbors, like my mom and dad, like my sister, and people that we love back at home. We cannot trade their health and security for tax breaks for the wealthy. It is time for Congress to do its job. Extend the premium tax credits and protect Medicaid and put working families first. Thank you very much for your time today.
Mariah, thank you for your mad. We appreciate it. While the Republican Speaker of the House has canceled 2 weeks of votes, Democrats have remained here in Washington, ready to reopen government and lower health care costs for the American people. Republicans in Congress and President Trump promised to lower prices. They haven't. Instead, the Trump tariffs are driving up costs for small businesses and consumers. The proposed Medicaid cuts would leave millions without coverage, and cuts to the Inflation Reduction Act are pushing energy prices higher. Now, as Democrats fight to protect the Affordable Care Act's premium tax credits, House Republicans are nowhere to be found. This is not what working families need. They need stability. They need a government that works for them, one committed to keeping health care affordable and accessible. Republicans like to say the best health care is a job. But even for Americans working full time in today's economy, affordable health care remains out of reach. One of my constituents, Miss Evans, from a rural community in my district, I have 4,500 farms in my district, plus the city of Chicago, recently shared her story. She works hard in the agricultural industry and loves her job, but her employer doesn't provide health insurance. Thanks to the Affordable Care Act, she can afford affordable coverage through the marketplace. Before the ACA, many women's preventative services were not covered. Today, Ms. Evans receives annual checkups and screenings at no cost. And because she has a family history of colon cancer, the ACA ensures she can continue to receive life-saving screenings. This preventative care not only keeps her healthy, but it also saves her money and gives her peace of mind. But Ms. Evans is worried if the ACA premium tax credit expire, her monthly costs could double. She earns too much to qualify for Medicaid, yet not enough to afford a massive rate hike. If Republicans believe the answer to health care is simply to get a job, then we should ensure that every working American can afford quality health care. I will continue fighting to stop this Republican manufactured health care crisis and to keep costs down for workers like Ms. Evans. Now, I'm very honored to introduce our next witness who understands the impact ACA cuts will have on rural workers like Ms. Evans. I'm honored to introduce our next witness. His name is Dr. Bruce Pulliam, an emergency physician from Southern Oregon who has spent the last 13 years providing life-saving care in a community hospital setting. Originally from rural Northern California and raised by two public school teachers, Dr. Pulliam's path to medicine was made possible through government-supported scholarships, loans, and grants. Resources, he said, were essential to his ability to serve the community he now calls home. Today, he brings firsthand insight into how shrinking public investments in education and healthcare is deepening provider shortages and straining rural hospitals. Dr. Pulliam has been a strong voice for policies that preserve access to care and strengthen the healthcare workforce, particularly in underserved communities. Thank you for your work.
Good morning. Again, my name's Bryce Pulliam. I'm proud to be a board-certified emergency physician, as well as a founding member and the current chair of the Southern Oregon Providers Association, which is part of AFT's Northwest Medical United Local 6552. I live in Southern Oregon and work in a community emergency room. My colleagues and I show up 24 hours a day, 7 days a week, 365 days a year with one goal in mind: to provide excellent care for patients in crisis. Being a doctor is often challenging, but it's become harder because our nation's healthcare system is on life support. Unfortunately, Republican policies are making this worse. This summer, they worked with the Trump White House to enact a partisan law that slashed Medicaid, and allowed healthcare tax credits to expire for working families, all while funding tax breaks for billionaires. They did this at a time when our healthcare system was already at a breaking point, with a national nursing shortage and too few doctors to care for those who need us. Our nation's emergency rooms are packed. Patients receive care in ER hallways, and hospitals are so full that patients have to wait hours or days to be admitted. Television show The Pit doesn't lie. This is real life. As emergency physicians, we see patients with life-threatening emergencies like sepsis, strokes, or heart attacks. But we also pride ourselves in caring for anyone who comes through the doors, including those who come to us because they have nowhere else to turn. If Republicans succeed with policies that defund healthcare, we will see a crisis at every level of our system. Hospitals and clinics will close or cut essential services, forcing patients to travel further and wait longer for care. Up to 14 million people could eventually lose their healthcare coverage, and millions more will see their healthcare premiums increase. This could literally mean the difference between healthcare and being able to afford rent or groceries for the most vulnerable. If we keep cutting from our healthcare system, we aren't just trimming fat, we're cutting to the bone. That means that someone's best friend or family member, like Matt, will have to forego care, skip medication, or delay going to the doctor. They'll get sicker, and both red and blue communities will suffer. I know this as well as anyone coming from a red district in a blue state. It doesn't have to be this way. What we ask for is simple. Protect and expand coverage, invest in safe staffing, and fund community hospitals so care is available where people live. I'm here today for my patients who deserve excellent, affordable, and accessible care. Instead, many are about to receive notice that they're losing the tax credits that enable them to be able to afford health care. All because Republicans' budget prioritizes tax cuts for billionaires over the health of millions of Americans. Excuse me. It's time the Republicans return to DC and do their work. They need to end this government shutdown and work with the Democrats to restore and rescue the health care that's now at risk. I always strive to do what's right for my patients. The Republicans that control Congress and the White House should do what's right as well. Instead of creating a healthcare crisis, they should work with Democrats to fix it. The health of our communities depends on it. Thank you so much.
Well, thank you, Doctor, for your testimony. I want to thank all our witnesses for being here today. I want to thank Leader Jeffries and the congressional leadership for your opening remarks, and to the witnesses all for being here. You know, as has been mentioned, Republicans have the House and they have the Senate and they have the White House. They could end this shutdown today, but they've refused to negotiate with Democrats. And Democrats will continue to fight to protect and save your health care, and Democrats in Congress want to keep your health care affordable. In my district of California's 44th district, 22,000 people will see their health care costs increase and thousands will lose their coverage entirely. For a 60-year-old couple earning $82,000 a year, annual premiums will increase by $13,783 or 286%. That is insane. It's unacceptable. I now will recognize myself for the purposes of a question. Ms. Brooks LaSure, why is it so important for the healthcare tax credits to be extended now? And why can't Congress wait until December, as Speaker Johnson suggests?
Yeah, so thank you so much for the question. The tax credit should have been extended in April. That's when insurers start making estimates of what the premiums are going to look like. They are what we normally see in a normal year is right now, people who are on the marketplaces should be getting notices telling them what their premiums are going to be. And that's why the tax credits should be extended now. And waiting until November 1st is too late, because when people come to the marketplace to shop and have sticker shock, they don't come back. They leave when they see this is not affordable for me. And that's why it's so important that tax credits be extended immediately.
Thank you. That's such an important point. I now want to recognize my fellow co-chair, Debbie Wasserman Schultz, for a question.
Much, Co-Chair Barragan, and thank you to all of our witnesses. And Ms. Brooks LaSure, you deserve the applause as well. So don't. And thank you for your service. I know that CMS job is a hard one. Dr. Pulliam, you're on the front lines, quite literally, of our healthcare system, and I'd like a sense Now, don't take this the wrong way, but you look like you may have been around prior to when we had more access to quality, affordable healthcare under the ACA. So, over the course of your career as an emergency room physician, can you talk about how our healthcare system has become increasingly under more and more stress, and particularly when patients can only use the emergency room as their primary access point for healthcare? What does that look like when they can't afford their insurance or their deductibles, and the first time they go for healthcare is when it's an emergency?
Sure. So, a lot of parts to that question, but I think first and foremost, just to highlight, our system is under stress and stretched to the breaking point. It's hospitals across the nation facing nursing shortages. In communities, we are losing primary care doctors. We're losing specialists that patients need to see for their advanced conditions. Provider burnout, whether it's nurses, doctors, techs, is at an all-time high, and that's driving even more talented people out of the profession. And yet, what we see is patients who come in to the emergency department because that's the only place they can turn for care because they don't have a primary care doctor or they can't get to a specialist. And it's great. I have a federal mandate to see anyone who walks through my doors, and it gives me a ton of freedom to care for literally anyone or anyone that shows up. But I am not an endocrinologist. I'm not a gastroenterologist. I'm not a neurosurgeon. And sometimes to get those patients to those specialty cares that they need, one, we have to refer them. And if they don't have insurance and can't afford insurance, those visits are cost prohibitive. They are hundreds, if not thousands of dollars. And two, when our system is stretched as thin as it is, I see patients who come in who have a first-time seizure, and I say, we need to send you to a neurologist. I refer them to a neurologist. And then I see that same patient 6 months later having another seizure, not on medications, because they couldn't get to a neurologist or a cardiologist or whichever specialty they needed to get to because they're booked 6 months or a year out. Even when the specialties are available, our patients are struggling to access them. And unfortunately, the emergency department, we are jacks of all trades, and we are there to help anyone, but we can't fix everything.
Thank you. I believe we're going to our co-chair, Representative Robin Kelly, for the next question.
All right, since they will ask questions, I'll ask you. My district is urban, suburban, and rural, and as I said, I have 4,500 farms in my district, and in my district, 2 hospitals, if they implement everything they want to, will shut down. So I want you to talk a little bit more about that, the length of time people have to travel and how close hospitals are to you now, or even federally qualified healthcare centers.
Really, thank you for that question. So in West Virginia, we have a threshold that a lot of people go by to determine whether or not seeking healthcare is worth it, right? How bad does it hurt? Does it hurt bad enough to drive an hour or an hour and a half? Does it hurt bad enough to wait in the waiting room once you get there for another hour and a half or more? And so what ends up happening is that a lot of people don't go to seek healthcare in the first place, right? They just suffer in silence because that's the West Virginian tough bootstrap thing to do. The further and further away and the less accessible these facilities become to regular everyday Americans, the more that culture of suffering in silence is going to pervade. People are going to die younger, they're going to get sick younger, and their overall quality of life and ability to work and earn a living is going to suffer as a result. I know for me, as a 29-year-old woman who is lucky and deeply in love with my boyfriend, we want to get married one day and possibly have a family. That's a really big deciding factor for me. Do I want to risk getting pregnant in a state where reproductive health care is so dangerous and tenuous, and risk the now 40 minutes, soon to be hour and a half long drive to the closest hospital if something does go wrong or when I eventually might need to deliver the child. That's going to factor in heavily to whether or not we decide to grow our family in West Virginia, whether or not I can afford to continue to live in the state that I love so deeply. Because at the end of the day, it's going to come down to the pennies, right? And how bad does it hurt? I hope that answered your question.
Thank you so much.
Bonamici.
I really appreciate it. And I wanted to ask you, I'm from Oregon, Dr. Pulliam, welcome. And in our state, in large part because of longtime leadership in our state legislature, about 97% of Oregonians do have health insurance right now. But like Representative Kelly, I represent a district that has urban, suburban, and rural. In fact, I was just at a ribbon cutting of a community health center out in rural Tillamook County over the weekend. They're extremely concerned about possible cuts. In Oregon, the average increase in premiums for people will be more than $1,000 if the tax credit bill is not remedied, and that's what we're here to fight for. But what I wanted to ask, and if each of you could respond briefly to this, sometimes people say, well, the Medicaid cuts don't affect me because I'm not on Medicaid. So can you talk about what it means to everyone if these cuts go through, if the Medicaid cuts go through, if the premiums go up? What does that mean to everyone in Oregon or in your state? So I want to get the message out there that this doesn't just affect people on Medicaid. Thank you.
Lee, do you have a question?
I'm happy to start and just to say, Medicaid has become so important. It's important to our states. It's certainly important for the people that rely on it, but it's also important for our healthcare providers. And what we're hearing is just how much a lot of the healthcare system was already taxed. Medicaid was helping a great deal. Most of the rural hospitals in this country get a lot of their revenue from Medicare and Medicaid. And so the cuts to the program, whether it's fewer people being enrolled or whether it's states not being able to spend as much money, means that some of these facilities will not be able to stay open. And a lot of our country, already people have to travel for a distance to get their care. And so we're already seeing that hospitals are saying, hey, in 2 years, my revenue is going to go down. And that's why we're already seeing and hearing reports of provider systems not going ahead and investing in expansion, closing their doors, certain parts of their programs like labor and delivery, or closing their doors
We
altogether.
just had a labor and delivery unit close in Seaside Hospital, which is on the coast in a pretty rural area. And the question is, well, where do you go now? Dr. Pulliam?
Yeah, so, I can speak to this as an emergency physician, and it's not unique to any one hospital. Waiting rooms are full. Patients wait hours, sometimes 6-8 hours to be seen in our ERs nationwide. And if we are the only place that people can turn to get even the most basic care, we are thrilled to be able to care for them. But also, there are only so many doctors, there are only so many nurses, and those wait times are going to go up. Patients who are legitimately sick will be in the waiting room hoping that someone gets discharged or a bed becomes available. To speak to, clinic closures, we have a large population of Medicaid patients in our valley in Southern Oregon where I work. And clinics rely on those patients to keep their doors open and keep the lights on. And if those patients can't afford care even when they need it, those clinics will have less patients, not be able to sustain their operations and close. And so even patients who did have private insurance or are millionaires aren't going to be able to get into specialty care that they need,
Right.
Because all of us are funding the healthcare system. We all need healthcare. It is a universal need. And Clinics are there to care for everyone and expect to care for everyone.
Thank you. Ms. Plant, did you want to add anything to that?
I think that Dr. Pulliam really hit the nail on the head, and it's important that we all recognize that these cuts aren't going to trickle down and affect everybody. They're going to hit us like a tsunami. It's going to hurt really, really, really bad. Because if you go to a healthcare facility that accepts Medicaid, period, Medicaid helps fund your healthcare, because the doors aren't just going to close for poor people. They're not just going to close for the uninsured. They're not just going to close for people on Medicaid. They're going to close for all of us. And no matter how much you have in your bank account or how fat your wallet is, when you drive up to Welch Community Hospital and the doors are locked and the lights are off, you're up a creek. Literally, it's up a creek.
Okay.
Thank
so
you. I yield back.
Thank you. And we'll just ask members to stick to one question, please. Representative Beatty.
Thank you. I'm from Ohio, and while I don't have a lot of farms, I have a lot of small municipalities that would be what I'm going to call rural-like. And then I have a lot of suburban and inner city. And so I think it all works the same. But I want to piggyback on my one question off of Congresswoman Bonamici in a more direct way. You've all answered it or stated to it, but we get a lot of people who think that there are Medicaid nurses. And I need you to tell me that that's not true, and Medicaid doctors. And to your point, Mariah, they then think it doesn't affect me because that's the Medicaid part. And I think it's very important for America to hear what this Republican administration is doing, is giving us false information or leading us to believe false. So if each one of you on the record in the mic could say that, and you've kind of touched on it, that there are not Medicaid nurses or assistants or doctors. Matter of fact, with the law, they don't even know when people are coming in what their billing is. But I think that is so important because people have said, oh, it won't affect me. I'm not on Medicaid. You know, I can see a nurse or a doctor. Thank you.
So yeah, as an ER doctor, again, I get to see anyone who walks through the door, regardless of what their insurance is, or even if they don't have insurance. I'm a doctor for everyone, but Medicaid helps fund our emergency department. It pays for techs, it pays for doctors, it pays for nurses, along with your private insurance. We are not one or the other, all or nothing. We are everyone.
The answer. Representative Horsford.
Thank you, Mariah. It's thank you for centering the voices of real people and your brother Matt. It's a blessing, I'm sure, that you are in his life and that you're providing him the care and attention that he needs. I wanted to ask you, as a small business owner, you know, we're dealing with a lot of policies that are creating a lot of economic uncertainty for small businesses. So can you talk about how difficult it is to start a business to begin with, and particularly as it pertains to healthcare costs, how these enhanced premium tax credits have allowed you to have the coverage as a small business owner, and what is that impact to other business owners if that goes away or is not available to you?
And thank you for that question. So for me, as a small business owner, which has been my dream my whole life, is to run an arts educational program for teens and tweens in Appalachia. And that's what I get to do for a living, is play pretend. It's so much fun. But we are currently experiencing a time where parents can no longer afford to send their kids to extracurricular activities that cost money. They can't afford to contribute towards costumes and sets. And so I'm seeing it on one side of my direct income is being hit by people not being able to access these little extras because the economy is already hitting them so hard. But then also from the other side of it, as a person who needs healthcare, who needs to be able to take my medication and get my glasses and all that good stuff, you know, $388 is the difference between, like I said, 2 car payments. It's the difference between whether or not I can afford to pay my insurance for my business. It's the difference between whether or not I can afford to buy supplies. And it's making me ask that same question about the threshold. How bad does it hurt? Does it hurt bad enough to sacrifice this part of my budget in order to go and get care? And for me, I can say that if the EPTC goes away, I simply will go without. I will not have health insurance and I will not go to the doctor because I can't afford to. So this really is a life or death situation for myself and for so many other people who are young and bright and inspired and want to contribute to our society and be successful. But it really feels like there are chains dragging us down, and that, you know, our state, our country, our government is not rooting for the small business owner, for the middle class American. And that's really where I'm feeling it is on both sides of my income and also the healthcare piece.
Mark.
Thank you so much. I just want to thank thank you, Mariah, Dr. Pulliam, for really just putting the human face on this and what this fight is about. And that's why we're in this fight. And thank you for sharing the story of your brother. It's those stories of how families come together and provide for the ones they love, and how these tax credits, Medicaid, all work together to give people a solid floor so they can have no ceiling on the success and the ability to care for their families and to build a business. And we're just really grateful for that. That's our motivation for this fight. It is our motivation why we are imploring Republicans to end this shutdown, come to the negotiating table. But Republicans are trying to define this as something else. So I'm hoping that you, Chiquita, can clarify for us. Isn't it true that under federal law, only citizens or legal residents are able to obtain coverage under Medicare, Medicaid, and the ACA?
Yes, the law is quite clear that to be enrolled in Medicare, Medicaid, and the Affordable Care Act, you are either an American citizen or you are a legal immigrant. And the idea that this is anything other than fighting for the American people, the millions of hard-working Americans, is just completely false.
Thank you. I yield back.
Thank you so much. Thank you, Whip Clark. And thank you all for your testimony today. I know it's not easy to step forward like this, but it's incredibly helpful and important for us to hear your firsthand account and stories. And it's clear that America faces a healthcare crisis that we must solve immediately. This is a right now problem for millions of Americans. Co-pays, premiums, and deductibles will skyrocket, and millions will soon be priced out of any coverage at all. And that drives up costs for everyone. House Republicans are AWOL. They need to end their paid vacations and negotiate with Democrats on a spending bill that avoids this GOP healthcare crisis. Ignoring a crisis that guts healthcare for tens of millions of Americans is unacceptable. And canceling 2 weeks of votes isn't a negotiation, it's an abdication. We need an honest dialogue to find real solutions. But GOP lies about immigrants getting tax credits and Medicaid just pollutes our prospects to solve this crisis. Every reputable journalist who looks at this fraudulent claim determined that it is a pants-on-fire lie. What is true is 20 million Americans face massive price spikes on their healthcare bills, with premiums doubling. What's also indisputable is Republicans' historic Medicaid cuts, which will already result in 15 million Americans losing healthcare. Those are real, verified facts. So let's start there and bury Republicans' immigrant-bashing lies and have a real debate and negotiation. Let's watch this video to break it down.
They would rather give taxpayer-funded benefits to illegal aliens.
That's just not true. Fact. Undocumented immigrants can't get federal health care programs, no comprehensive Medicaid, no ACA subsidies. Here's another fact. Republicans are trying to take health care away from 15 million Americans. and raise healthcare premiums for millions more. Healthcare costs are rising because Republicans want to give tax breaks to their billionaire friends, not because of immigrants. Stop the lies. Protect healthcare for all Americans.
Well, thank you. As we come to a close of this portion of the hearing, I want to thank our witnesses, the Honorable Brooks LaSure, Ms. Mariah Plante, and Dr. Pulliam for your expertise, for uplifting how these healthcare cuts harm our communities. Your stories and your testimony is so, so powerful. House Democrats will not stop fighting to protect healthcare for all Americans. And with that, we will now transition to the second panel of this hearing. We will hear from members directly on how their constituents are impacted by this Republican healthcare crisis. We are starting with panel number one, Representative Rob Menendez, Representative Greg Stanton, and Representative Mike Johnson.
Facing all of our constituents. Over the past week, House Republicans have literally gone on vacation while millions of Americans are facing an unprecedented healthcare crisis. The Affordable Care Act premium tax credits that help millions of hardworking Americans afford their insurance are set to expire. Because Speaker Johnson refuses to hold votes, Americans, our constituents, will suffer. In my district, the numbers are pretty staggering. A family of four making $129,000 a year will pay $14,444 more for their health care, a 161% increase. A 60-year-old couple making $82,000 a year will pay $23,788 more, a 526% increase. Who in the hell can afford to pay that type of money for insurance? It is obscene what they are doing, what the Republicans are doing. Nationally, the picture is just as bad. More than 24 million Americans will either face higher costs or lose their coverage altogether, including 1,600,000 children, 3,300,000 small business owners. And remember, when we did the Affordable Care Act, a big part of the justification and why it was so supported so strongly is because it allowed small business owners, self-employed individuals to finally get health care coverage. And the irony is more than half of the Americans affected live in Republican congressional districts. Even our Republican colleagues are sounding the alarm. I never thought you'd hear me say I agree with something that Marjorie Taylor Greene said, but I do. And I quote, "My own adult children's insurance premiums are going to double, and not a single Republican in leadership has given us a plan," end of quote. At the same time, Medicare telehealth coverage has lapsed. Doctors across the country are canceling appointments. One woman who called my office said that without a telehealth option, she can't afford to get her care because she lives so far away. The Uber bill is $100 each way. There's bipartisan support to fix this, but the Republican leadership won't call their membership back, and they won't allow a vote on the floor. And let's remember, by federal law, undocumented immigrants, notwithstanding all the malarkey we're hearing, are not eligible for federally funded health care. Congressional Republicans know this, but they're spreading disinformation. Madam Chair, they're lying. They're lying to distract from their inaction. Democrats are here, ready to protect Americans' health care. It's time Republicans come back to work. Again, thank you for holding this hearing. It's extremely important for my constituents, as I know it is for yours. I yield back.
Well, thank you, Mr. Thompson. I now recognize the gentleman from Arizona, Representative Greg Stanton.
Chairman Barragan and the other members of Steering and Policy, this is an important hearing. We're on day 8 of a government shutdown, all because Donald Trump and the congressional Republicans would rather shut down the government than work with Democrats to do the right thing, to protect Americans' health care. After Speaker Johnson canceled votes again, I spent the last few days in Arizona meeting with the people who will pay the price if Congress lets the health care tax credits die. On Monday, I sat down with small business owners. One of them was a young entrepreneur who runs a thriving salon in Phoenix. She pays $280 a month for ACA coverage, steep but manageable. That insurance lets her get the care she needs to keep working. Without these tax credits, she will lose her business. Her exact words, quote, "Let me keep doing what I love without sacrificing my health to do it." Another entrepreneur from Chandler wrote to my office terrified. After medication, bills, and rent, she has $200 left each month for groceries and everything else. That's on a good month. She ended her letter to my office with this, quote, "I'm begging you with all my heart not to give in no matter how long it takes." This is not a political game. These are real people facing impossible choices, groceries or health care, a roof over their heads or treatment for their children. Their dream of owning a small business or peace of mind that if they get sick, they won't go bankrupt. None of us want to shut down. We hate the shutdown. It hurts federal workers, thousands of them in Arizona, and everyone who depends on them. But I can't look at myself in the mirror if I abandon my constituents who are barely hanging on. If these tax credits expire, the average Arizona pays almost $800 more out of pocket. Families, thousands more. That's a luxury price tag on something that should be affordable. People don't stop getting sick when they lose insurance. They stop seeing doctors. They skip preventative care. They cancel appointments. Then, when something treatable becomes critical, but emergency rooms, overwhelming our healthcare system. A Phoenix doctor told me this week, quote, "Reducing access to preventative care dramatically delays and increases the cost of care. When people finally do come into the doctor's office, it's because they're in a really dangerous situation." This is a manufactured crisis by the congressional Republicans, and it has a simple solution. Extend the tax credits. House Democrats, we're here. We're ready. We can fix this crisis today. Republican, my friends on the other side of the aisle, come back to the table, extend these critical ACA subsidies, end this shutdown. That's exactly what the American people want, they deserve and they need. I yield back.
Well, thank you, Mr. Stanton. I now recognize the gentleman from New Jersey, Mr. Menendez.
Thank you, Chairwoman. Thank you to my colleagues on the committee for giving me the opportunity to speak today. Let's be clear about where we stand. This shutdown is no accident. It's a direct result of the Republican healthcare crisis and the broader effort to roll back the Affordable Care Act and to make healthcare more expensive for all Americans. This week, I visited the North Hudson Community Action Corporation, a cornerstone of our community and one of New Jersey's largest federally qualified health centers. North Hudson Community Action operates 10 health centers, 4 Head Start and Early Start facilities, and 2 social services offices. They accommodate over 268,000 patient visits every year. Families, workers, and seniors who rely on them for everything from medical and dental care to behavioral health and early childhood education. They employ more than 750 dedicated, hardworking staff, people who have devoted their lives to helping others. But what I heard during my visit was deeply concerning and a reminder of the real-world consequences that Republicans' actions have on all of our communities. Their team told me how the uncertainty caused by the Republican-led government shutdown is threatening the very programs that our neighbors rely on, programs like WIC, Head Start, and public health. These are lifelines for working families in Hudson, Bergen, and Passaic counties, and yet Republicans are using them as bargaining chips in a political game. Republicans' health care plan will devastate access and affordability for people who rely on North Hudson Community Action and organizations like it. And unless we act soon to extend ACA tax credits, premiums are set to rise drastically for families across the country. A family of 4 in my district making $64,000 per year will see their annual premiums more than triple. That is completely unacceptable. That's why House Democrats will continue to hold the line, fighting to expand healthcare access, lower costs, and fund the government responsibly. We believe that federally qualified health centers like North Hudson Community Action deserve stable funding so they can continue doing the life-changing work that they are committed to doing every single day. I told the team at North Hudson Community Action that I would carry their message back to Washington, and I am thankful for the opportunity to do so today. But more than that, their team and the thousands who rely on them are counting on us to take action. This fight is too important, and we are in it together. Thank you, and I yield back.
I want to thank our first panel for your testimony. Hearing about your constituents is a testament of this being a problem across the country in every district. If we had Republicans here today, maybe they would share some of their stories. At some point, we'll hear from constituents, hopefully across this country. And with that, we will move to the second panel of members. We have Representative Glenn Ivey, Representative Suzanne Bonamici, and I see Representative Deborah Ross is here. We will have Representative Ross. Okay, we will start with Representative Suzanne Bonamici.
To the Steering and Policy Committee for holding this important hearing to expose the Republicans' continued assault on Americans and their pocketbooks by making devastating healthcare cuts and driving up the cost of health insurance significantly. Republicans' cruel budget, the big ugly bill, will decimate Medicaid to pay for tax cuts for billionaires. And now they're continuing their heartless obsession with destroying the Affordable Care Act. These Republican policies are putting rural hospitals and clinics at risk of closure, which hospitals and health systems in my state of Oregon described as catastrophic. Last weekend, I joined a celebration for the newly opened Nehalem Bay Health Center and Pharmacy. It's in a rural coastal town in the district I'm honored to represent. The center is replacing an older clinic and doubling the capacity of the patients who can be served. Hundreds of people showed up in support. And these rural clinics are critical. Without clinics like Nehalem Bay, people are forced to travel for hours, sometimes on dangerous roads at night, to seek the care they need if they can find another provider. And the Republican assaults on our healthcare system put rural clinics like Nehalem Bay and others and the patients they serve at risk. These cuts to healthcare and the Republican shutdown more broadly are emblematic of the first 9 months of the Trump administration, causing constant chaos and inflicting incredible harm to people and families. Too many Oregonians and Americans already struggle to afford health care. I will not be complicit in the Republicans' plan to kick millions more off of their insurance, or if they get their insurance through the ACA, to make their costs skyrocket. In my district, a family of 4 earning $64,000 a year would see their premiums rise 275%. This is unacceptable for families who are already counting every dollar to afford necessities. This past weekend, I held 2 town hall meetings, something most Republicans still refuse to do. And I heard that many of my constituents are extremely worried about the already high cost of living and how these Republican healthcare cuts will further harm them and their families. My constituent has a son who's an adult with developmental disabilities, and because of Medicare and Medicaid, his son is able to live independently. Cuts and reductions threaten that independence. You know, Donald Trump said he was going to lower costs, but his chaotic policies are making costs rise, not fall. People across the country are struggling to pay for housing, groceries, and childcare. And if healthcare premiums skyrocket, they will reach their breaking point. Oregonians and Americans are desperately trying to understand why Republicans are choosing to fund tax cuts for billionaires and halt essential government programs rather than helping hardworking people who are already struggling to get the care they need. Democrats in Congress are fighting to protect healthcare and are imploring our Republican colleagues to join us in ending their shutdown and in ending this impending and preventable further healthcare crisis. The American people deserve better than they're getting from this administration, and these recent attacks on healthcare are yet another example of why. Thank you very much. I yield back.
Thank you, Representative Bonamici. I now recognize Representative Deborah Ross.
Thank you very much, Madam Chair and members of the Steering and Policy Committee, for holding this important hearing where you can hear about what is happening around the country to people's health care. I'm proud to stand with my colleagues today and speak about the dangerous and deliberate choices that brought us to this point. The Republican-led shutdown is not over policy disagreements. It is the direct result of the extreme agenda that treats access to health care as expendable and views the well-being of working families as a bargaining chip. At the center of this crisis is the GOP's refusal to extend enhanced premium tax credits, which have helped millions of Americans afford coverage on the ACA marketplaces. These tax credits have kept families afloat in the face of rising costs and economic uncertainty. In my home state of North Carolina, nearly 900,000 people have seen that keeps Zoe thriving and out of the hospital. Leah Carlton, a resident of a rural mountain community in western North Carolina, suffered multiple strokes and lives with ongoing complications. Without the enhanced premium tax credits, her insurance costs will skyrocket to nearly $30,000 a year. And she told me plainly, without this coverage, she may not have survived. Furthermore, She may not have made it to the hospital at all, for the rural facility that treated her is now at risk of closing under Republican efforts to cut federal Medicaid funding for rural hospitals. North Carolina has made extremely effective use of federal healthcare dollars. Our long overdue Medicaid expansion has helped fund and stabilize rural hospitals, expand access to behavioral health and substance abuse disorder treatment, and integrate whole person care through programs like Healthy Opportunity Pilots, which address social drivers of health such as housing, nutrition, and transportation. That progress now hangs in the balance. If the enhanced premium tax credits are allowed to expire and the deep cuts to Medicaid take effect, the impact on our state will be catastrophic. On my way here, I was on the plane with a Republican state senator who has come to Washington, D.C. to talk about the effects on Medicaid and ask for federal government assistance. He may not be talking to the House members from his party, but he sure talked to me, and I hope he talks to our senators. Instead of acting to preserve programs that have been transformative to millions of American families, House Republicans are walking away. They let the clock tick down and refuse to guarantee credits remain in place, leaving families in limbo, insurers in flux, and state exchanges unable to provide certainty for the next cycle. And this isn't occurring in isolation. It's part of a much broader pattern where my Republican colleagues choose to harm the welfare of working Americans in order to reward the wealthiest among us, cutting essential programs and weaponizing federal agencies that sow divisions. The big ugly law, which slashes more than $1 trillion from Medicaid and makes it harder for people to enroll in Medicare and CHIP, will leave millions of Americans uninsured. And that's not just a budget. It's a blueprint for decimating America's healthcare system. The shutdown the Republicans engineered is accelerating the very crisis they created. And it must stop. Families across the country are watching their premiums spike, some hundreds of dollars a month, because House Republicans are holding these tax credits hostage. It's cruelty masquerading as fiscal responsibility. So I urge my Republican colleagues to get back to work. End this shutdown, extend the tax credits, reverse the cruelest cuts in H.R. 1. Families in North Carolina and across the country are watching and waiting. Thank you, and I yield back.
Thank you, Representative Ross, for sharing the stories of Shannon, Zoe, and Leah, and so many others. With that, I recognize the gentleman, Mr. Ivy.
Thank you, Madam Chair, and I want to thank the committee for hosting this hearing. I think this is super timely for sure, particularly for my community. We're in the middle of the government shutdown. I have tens of thousands of government employees who are suffering from that, but they understand that the healthcare crisis is critical, and they're strongly in support of us linking those two together because the Republicans have dug such a deep and dangerous hole with respect to healthcare coverage across the country, and they understand that. They know that the $1 trillion in Medicaid cuts is going to have a devastating impact on many Americans, not just in Prince George's County and not just in Maryland, but across the country. And ripping away the ACA tax credits has been devastating as well. We have, just in my county, the impact of those two things combined together, for example, with respect to the premium increase, a 60-year-old couple is looking at $11,581 tax increase in 1 year. That's $1,000 per month. That's the type of premium work spike that these couples, these communities are facing. Family of four is looking at a 200% increase under the same issues. So it's critically important for us to make sure we maintain this fight and keep pushing forward to make sure we protect the rights for Americans to have basic access to health care. I did want to mention, too, I've been getting a lot of questions from people about where are the House Republicans? I do want to make sure the public understands that the game they played was to try and pass a bill that they knew would be DOA and arrival when it got to the Senate. And they left town quickly, in part so they wouldn't have to be here to try and fix what they'd done, but also so they wouldn't have to deal with the Epstein files, because they knew we were about to pick up number 218 and have enough people to get that passed so we could force them to move forward on that. And then they had the nerve to complain and say that, you know, we don't have enough time to work something out on this healthcare issue, so let's just pass the clean bill. Forget that. For 7 months, starting from January 20th, we knew this day was coming, and they knew it was coming too. And when they passed the big ugly bill that contained the $1 trillion in tax and cuts to Medicaid, they knew the problem they were creating, because we presented it to them. We fought them about it with amendments and the like in committee. And then with respect to the Affordable Care Act, refusal to extend those tax credits to protect the American people, they knew about that too. I mean, Deborah Wasserman Schultz there is on the committee with me on during the fight when we were trying to present amendments to try and change that, and they voted them down every time. I think it was 3 at least on a party line vote. So they knew it was coming. They moved forward with it anyway. Then they passed that bill that they knew was going to be a DOA. Then they ran from town, and now I don't know if they're in the witness protection program. I don't know where they are, but they need to come back. And the last point on this, and I'll turn it back over. You know, people are asking about whether members of Congress should be paid right now, and I'll say this: the only federal government employees who should not be paid right now are House Republicans, because they're the only ones who are not here doing their job. They knew the mess they created. They left town, and they're trying to stay away because they're afraid to come back and deal with the mess and try and fix it. So with that, I'll yield back, but I want to thank the committee again for the work that it's done on this and for putting this together.
Thank you so much to our member panelists. This panel is excused, and we'll next turn to Representative Sarah Jacobs, Representative Dave Min, and Representative Brad Sherman.
That they're offering us a clean CR. First of all, yes, it reads like clean CRs I've voted on and voted in favor of before. But there are 2 issues. But they basically were sending a clean CR to a president with dirty hands. So first, they refuse to put in a provision that prohibits clearly and with teeth impoundment of the funds that we send. And second, they refuse to put in a provision preventing rescission. So what does this mean? It means we're supposed to pass a continuing resolution to provide funds for all of the functions of government, including ones that they support far more than we do. And then the president is free to defund whatever priorities he doesn't want, or to send to the Congress a rescission of any provisions. So instead of us agreeing that we continue government funding at the same level, they've got 2 mechanisms to defund Democratic priorities while funding Republican priorities. We're told that they'll negotiate on health care just as soon as we pass their bill. They wouldn't negotiate on health care in January. They knew in February that these credits were going to be abolished and 22 million Americans were going to face massive increase in their premiums. They knew that in March when they wouldn't negotiate. They knew that in April when they wouldn't negotiate. And come July, they said, you know, not only won't we negotiate, regarding the people who are going to lose their Obamacare subsidies that are necessary because otherwise their premiums double. We're going to take health care away from people on Medicaid. So they won't negotiate with us for all these months. Now we're supposed to give them what they want, and then they're going to negotiate? I don't think so. Fool me once, shame on me. Shame on you. Fool me twice, shame. Now, we have seen what happens when federal employees don't get paid. Burbank Airport lost air traffic controllers, a major airport close to my district. Massive delays. Why? Because some air traffic controllers decided to call in sick, as we're seeing that across the country. Now, the National Association of Air Traffic Controllers has urged their people to show up unless they are physically sick. But I have a difficult time telling people we're not paying you, but you show up for work. Now, why are we here? Why are we even talking about a continuing resolution? That's not the way to run government. There are 12 appropriations bills that should have passed the House of Representatives in the spring, maybe the early summer. And they should all have become law months before September 30th, because the people that run the government should have known months before their year began on October 1st what their budget was. Well, have Republicans who control both houses of Congress passed these 12 appropriations bills that function different parts of government? Not a single one. They haven't done their job, not in January, not in February, not in March, not in April and May. They have only 3 of those bills have passed the House, and none have passed, and of those 3, none were supported by the Senate. So why is Congress shut down? You know, the last time we had a major a major shutdown, it was when Congress was not scheduled to be in session. It was Christmas. But the time before that, Congress was open. We have to be open. If any federal employee is essential, Congress is essential because we're the only ones that can open the government back up. So what we were doing in 2013 when we had a shutdown, we had hearings on FEMA. I represent the Palisades. Those were important hearings. We had hearings scheduled today before Judiciary to deal with the Epstein files. No wonder Congress is shut down. We can't open up the government till we bring Congress back into session. Now, there is an issue where Democrats are divided. Some believe that all Republicans have been sent home because maybe some of them would talk to us about health care, and their leadership doesn't want to do anything on health care. Another chunk of Democrats believe that they sent everybody home so that we wouldn't talk about the Epstein files, and we wouldn't swear in Ms. Grijalva, who will then sign the discharge petition and force a vote on the Epstein files. I think both Democratic groups are right. They don't want to talk about health care, and they certainly don't want to talk about Epstein. So Democrats need to fight for those millions who are losing their health care, including, and I have the statistics for California, but I've gone on too long, and I bet you my colleagues from California will bring those statistics up. But millions of Californians are losing their health care because Republicans wouldn't negotiate in January, they wouldn't negotiate in the spring, and they won't negotiate now.
Thank you. Thank you, Representative Sherman. Members are reminded that each panel has an allotment of 10 minutes total. So if you could keep your remarks brief, that would be helpful. And Representative Jacobs of California, you're recognized.
Well, thank you. And I'm honored to be on this esteemed panel of Southern Californians. Thank you to the Steering and Policy Committee for convening this hearing today. One thing I think we need to be clear about is that the Republican shutdown didn't actually begin on October 1st. It began on January 20th. Since he took office, Donald Trump has been shutting down our government and stealing power through DOGE, mass firings of federal workers, slashing federal programs and departments, ignoring Congress's constitutional role, disregarding court orders, deploying the military on American soil against Americans, and so much more. So we should all be clear that whether or not we are in a technical government shutdown, it doesn't change Trump's calculus. It's not going to sway him if he wants to break the law and fire people or illegally deploy our troops on American soil, because he did it before. That's why this isn't business as usual. It's why there's no such thing as a clean state, and it's why we need concrete guarantees that this administration will respect checks and balances, recognize Congress's power of the purse, and protect Americans' health care. So here are the facts. Republicans control